Hello, and welcome to My Hospital Bag Simplified. My name is Selena Wieland. I'm a mom with two kids. I have a 24-year-old daughter and a 7-month-old son. I'm over 40 and took me like 20 years to decide I was ready to have another child, and which leads me to why I'm creating this video. I'm also creating this video for my niece Kylie, who is about to have her first child, and I'm very excited for her. And I'm hoping if you found this video that you find it helpful. I'm kind of trying to throw this together quickly for her. I've been promising this for about a month now, and I've been struggling trying to pull the stuff together so I could demonstrate, and I'm really awkward right now. So I figured we would go with skills I already have. I used to do a lot of training and presenting for my job. So I'm still working full time. I'm a QA lead for a software team. I live in the DFW area, so some of the things I may say may sound familiar to you if you're from the area. So let me just, Joey says to get a pen and paper, and we're going to get started, and we're going to go over the things that to help you get ready for to have your hospital bag or bags, so that when you go to the hospital, you're not having to make extra trips or keep sending people to get stuff or bring stuff. This hopefully will get you the majority of things that you need. And these are the things that I actually used when I was in the hospital and helped out a lot. So just to give you an overview, we're going to start with Dad's bag because that's the easiest. Then we're going to talk about what you need for baby. And then Mama's bag, which is pretty much everything else, which I'm also going to touch on electronics, home comforts, snacks, and just don't forget the car seat. And we'll talk about that a little bit later. So, starting first with Daddy's bag, here's a picture of my husband Daniel. He was such a sweetheart and such a great help during the whole process. He's can't say enough great things about him. He's just really awesome, really patient, and I'm a total shrew. So, so basically for Dad or whoever your partner is going to be. So if you're single or your significant others just gets on your nerves or really grates on your nerves and you want somebody else like your mom or sister or best friend to be there with you, basically that person should have their own overnight bag. What should they bring in their overnight bag? Their toiletries, toothbrush, etc. Stuff to take a shower in case they want to. My husband didn't really feel the need. Also, don't forget PJs. A thing I want to call out for Dad, if he wants to do skin-to-skin bonding, to have a zip-up hoodie. So this way he doesn't have to like take off his shirt and feel like he's half naked in front of total strangers. If he's self-conscious, Daniel usually isn't, but the hospital was cold. It was the middle of July and it was freezing. They kept it very, very air conditioned. It was great overall because, when you're in labor, your body temperature rises, you get kind of hot. Well, for my poor husband, he didn't have the luxury of being extra warm, so having the zip-up hoodie worked out. And then when I needed to get up, he would hold the baby and hold the baby on his chest and have that skin-to-skin bonding time too. Also, a change of clothes. I would recommend maybe an extra couple t-shirts in case the baby spits up on you. It won't be a whole lot as far as the amount the first days, but as hard as we tried to have a burp cloth in place, it didn't work out. So an extra t-shirt is nice to have. If they're going to stay in the hospital with you, bedroll or padding, extra padding. The chair in labor and delivery for my husband was not very soft at all. The little sofa bed in Our room, I forget what that's called, um, was more comfortable, but I kind of wish I had taken like a feather bed or memory foam kind of pad for him. But that's just kind of an extra thing that's not not necessary. Also, underwear and socks. Also, maybe flip flops or slippers, um, if that's more comfortable for you for like overnight. Like if you have to get up and go to the bathroom or you're just kind of lounging around. Um, we stayed in the hospital a total of 3 days, and I'll talk a little bit more about that towards the end of the video. So next, baby's bag. Um, I wanted to call out here the so the things that mommy should bring, and then what the hospital usually provides. And I'm going to start with the hospital. And so they had a package of diapers, newborn size, and they were fine. I think it was Pampers was the brand for Baylor and Grapevine. They had Pampers wipes, and they were like unscented for sensitive skin, which was great, which was in line with what we would do. Um, if for some reason you need to bottle feed, um, they have those supplies, and they already had formula that was already pre-mixed. If you need it, they give the baby a cute little, it's blue, white, and pink little cap, is what our hospital did. We didn't love it because it looked more pink, and yeah, we had a boy, so we wanted, but it was fine. We used it the whole time we were there. Um, they have receiving blankets on hand for you. I don't know if they give those to take home. We took one home, so sorry, Grapevine. We'll send you a check if you need payment. Um, they also provided the Halo Sleep Sack, which was like this little sleeping sack that zipped up and then had Velcro to kind of, you could wrap the baby. Basically, it made swaddling easy. They did, that hospital in particular does that now. They don't swaddle the babies anymore. And they also provided a pacifier. So for mom's bag, I would bring a diaper bag, one that's big and easy to get into, especially until you kind of figure out what your diaper bag style is. I've gone through 3 or 4 diaper bags. Right now I'm in a backpack, but at my baby shower, my in-laws gave me this nice big diaper bag, which was like perfect because it was easy to kind of open and dig around in. Um, Diapers, depending on how long you're there, you may need another pack of diapers. I packed all the different little loose samples I had from before that I received before the baby was born to have on hand to try if we needed them. We ended up not using any of them. Um, the wipes that I like best are cold water wipes. So we took a package of those, and I think I opened them up, but I don't think we really needed them. You need a going home outfit. Um, I recommend a zipper sleeper, something that's easy to put the baby in. Um, Also, for while you're in the hospital, depending on the time of year, they come and check baby every few hours while you're there. So we ended up, I like these little kimono shirts, and I'll show you an example in a sec. Just a little t-shirt, you know, I didn't want to cover his umbilical cord since they would be checking that. For him, he just stayed pretty much swaddled in the Halo sleep sack until we put him in his little baby swaddle so I could take a few pictures, and then moved him from that to his going home outfit the day we went home. Um, Also, I recommend you take a muslin blanket or whatever type of blanket you're going to use. I packed a couple muslin blankets and his swaddle blanket. So if you do like a swaddle blanket and a cap for pictures, I had gotten a blue set that I'll show you in a second. Um, but I also packed a muslin blanket, which is also good for swaddling. So I'm pretty sure if you really wanted to swaddle and didn't want to use a sleep sack, they'd let you. Um, Bottle and formula, kind of optional if you feel like you're gonna, if you're not gonna breastfeed. Although I highly recommend breastfeeding and getting that practice while you're at the hospital. Visit with the lactation consultant, have them help you. It just makes a huge difference. Um, and then you could take baby socks, mittens, and a hat. I had those in the bag. We didn't use them. And then I like the Wubba Nub, like the little animals attached to the pacifier. We had a little fox. I took that. Um, and that happened to be like the same brand of pacifier that the hospital gave. So he took that or the hospital pacifier, so it worked out great. Um, let's see. So baby's bag. Um, if you want to take toiletries, you can. I would recommend a clear zipper bag so you can kind of see what's in it, especially you're going to have your hands full holding baby. So it helps to kind of be able to point to whatever's in the bag when you're asking somebody to hand you something. I strongly recommend a nail file. I got the Nail Frida they're these little curved nail files. Those worked out good for baby's nails. It's amazing how fast they grow, and their nails are super sharp. Um, I also recommend like a brush for the baby's hair. It just kind of comes in handy. And I don't know, I felt inclined to kind of comb his hair, and it was so beautiful and silky and soft, and um, so you don't really have to brush it, but if you want to, take a baby brush. Baby wash, I think they used, I can't remember if they used theirs or just water on him. I do recommend letting them do the first bath. Um, Lotion you can take, probably more for you than for the baby. Baby skin is perfect. Um, be very careful when you're introducing new stuff in case they have an allergic reaction. Personally, you really don't need the lotion the first day or first few days. I don't think we even tried lotion probably till after 2 weeks, but that's up to you. So picture on the left is Joey. My son's name is Joey, in his little sleep sack, all velcroed in and snug as a bug in a rug. And then the picture on the right is the swaddle and cap we bought. I had like specially ordered it. I can't remember the website now. And I had wanted to get the matching robe, but it didn't work out, so I had a different robe. It seemed like it would have worked better to have the matching robe if I was having a girl. But, and the funny thing is, I think after I had received it, I saw the same set at Bye Bye Baby. But so you can find these swaddle sets locally, or you can find them online. But the material is like a really soft jersey material. Works fabulous for swaddling because you can really kind of pull it tight, and it takes a little while for it to loosen back up and the baby to wiggle out. And that's the hospital pacifier, if you're curious. Um, this is kind of what the kimono shirt looks like. I think I gave a couple to my niece. I think I bought a pack of like five, and um, I had intended to use it, but I never used it after we got home. We mostly kept him, he was either in just a diaper or I don't think we, I can't remember if we even bothered putting onesies on him until his cord fell off, but he was mostly in zippered sleepers. I would also recommend avoiding um, like the footed sleepers that have snaps at night, because if you're changing diapers in the middle of the night, it's a real pain. For us, we just didn't have the brain capacity to figure out snaps in the middle of the night, so we just avoid them. We just use the zipper sleepers at night. Um, so I'm going to kind of jump to electronics. So for me, um, because of the job I do, I have a laptop backpack or a backpack that's for my laptop and my stuff. When we travel, I normally use that for our electronics. So for the hospital, I can't remember. I don't think we took a laptop, um, but we took our iPads. So Daniel had his iPad. I had my iPad mini. We had a charging hub for, so like a USB hub for charging. And I'm trying to think. Sorry, I'm having to plug in. And I'm really sorry this video is just thrown together. This is my first video and I'm just trying to get this out for my niece. Anyway, okay, back to the electronics bag. So definitely take enough charging cables for whatever devices you're taking. So if you're taking a tablet, definitely your phone charger. I also recommend a power brick if you have one, just in case. Also make sure to get one really long cable to charge your phone. Um, let's see, USB charging hub, backpack. Also take a folder or two for paperwork. Make sure you kind of keep track of the paperwork. Also a notebook so that you can write down any questions. And then pens, for signing all the paperwork. The first day after having the baby, we had to fill out the stuff for birth certificate and everything. Hold on just a sec. Okay, so Mama's bags. Oh, I'm so sorry. I'm getting pinged for work and it's totally thrown off my brain. Okay, so focusing. So for my bags, these are the 5 categories or here's kind of the categories for breaking it up. First thing you need, have a suitcase. We took our very large suitcase that we usually take for big trips because I put all of our stuff in one bag for the most part. Although we ended up with 3 bags. We had a suitcase, we had the backpack for electronics, and then we had the diaper bag. And then the car seat. So 4 things altogether. We didn't take the car seat in until the day we were leaving though. So the first thing I want to cover is going to be postpartum care, and then clothes, and then toiletries. So let's get this started. Okay, for postpartum care, what the hospital provided is they provided these like stretchy kind of boy short brief, real thin, really didn't love them, in these really extra large pads. Kind of TMI warning, you will be bleeding a lot. Don't freak out. Ask your nurse how much to expect. They will tell you. If you get concerned, talk to a nurse. Get the reassurance you need. Having a baby is very traumatic. At my age, I had like extra care because I'm over 40. When you're younger, and I don't know if they're like this everywhere, but my experience was they kind of brushed everything off because I was young. They're like, yeah, everything will be fine. There's a lot of questions I didn't ask. So ask lots of questions. That's what they're there for. They almost everybody I talked to was very nice, answered all my questions, even questions I asked more than once. So don't be afraid to ask questions. This is a very important time for you. So, um, you know, be your be your champion. Um, if something doesn't feel right, let them know. So moving on. Um, I like the always discreet briefs. They're kind of like paper underwear, but they have the pad built in. It holds a lot of liquid, so it worked out. For me, I didn't have to change. I changed the pad every time I went to the bathroom. So the first day I used what the hospital gave me. The second day I was over it, so I started using my always discreet briefs. So much easier. Um, you're gonna need witch hazel pads for swelling down there. Um, the hospital will provide some, um, but I recommend having extras on hand, just especially for when you go home. Also, hemorrhoid cream. If you need it, the hospital will provide the equivalent, but definitely have some on hand just in case, especially if you run out of theirs and it's taking them a while to get back to you. They'll provide you a peri bottle to help clean that area. I recommend having an extra one just in case. I had a near meltdown at home because mine had fallen and I couldn't find it. And you definitely want to keep that area clean, and so having an extra just um, works out. I ended up getting a pack of 3, so I had a bottle in each of our bathrooms, so I was covered after I got home. I also recommend this Earth Mama Herbal Perennial Spray. It helps soothe the area. I would just apply it when I went to the bathroom, or after I was done cleaning up. Be sure that when the nurses explain how you're supposed to clean up, if you don't understand, ask. It definitely makes a big difference following their instructions. Also, nipple cream. This one is the First Years is the brand, and it's nursing care. And this goes on like you squeeze it out, and it goes on real easy. It's of the different ones I had, this was like the easiest to apply, and it definitely was soothing. And then it usually kind of soaks in. So when you're done nursing, um, it'll soak in, so it's not like you have to wipe it off the next time you nurse baby. Um, so what to wear? In the hospital, I mostly wore the gowns that they had. It wasn't until my last day there that I put on my own nursing gown. So definitely get a nursing gown, because as you're sitting there in bed and people come and check you and probe you, you want kind of something loose fitting and comfortable, especially for laying in bed with a baby. Um, Also, something that's easy for you to nurse in. And yeah, you're going to have people coming like in the middle of nursing, and you can tell them to wait if they're checking your vitals or whatever. If they're going to disturb baby, they can wait a minute. But definitely get a nice comfortable nursing gown. This one's like the one I had, but mine was black. It was recommended by one of the YouTube channels I watched to have a black one, because if you bleed on it, you won't really notice as much. Doesn't look as bad. Um, so your going home outfit. You need a nursing bra. Obviously, your underwear, socks, whatever you wear or feel like you need, but definitely a nursing bra with a nursing top. Try them out before you go to the hospital just to make sure you've got the fit right. So the last probably 2 months of my pregnancy, I was wearing my nursing bra as my bra. So it was nice and stretched out and comfortable. um, I had a nursing top. That was definitely, I didn't try it out before, so it was a little bit awkward. My first time, because I tried it on when I bought it, but I didn't try it out to see how it works, so it was a little bit awkward when I was going home because we were waiting around for them to release us, so I had to nurse, and it took a little bit longer to get positioned than I was prepared for, and poor Joey was getting a little bit upset with me because he was like, "Hey, I'm ready, feed me," and mommy was struggling with her clothes. Anyway, comfy shoes or flip-flops. I used to wear these sandals when I was pregnant. That's what I wore to the hospital, and that's what I went home in. Also, for around the hospital, I did have these fuzzy socks that had the little rubber grippies on the bottom because they really want you to be in something non-slip. Otherwise, they'll give you the hospital socks, and I didn't like those because they don't want you to slip and fall. They're very at Baylor Grapevine. They definitely. I got like three, not lectures, but that's the only word that's coming to mind. Lectures on what to do for getting up and getting out of bed and going to the bathroom and asking for help. And right after you have the baby, the first time you go to the bathroom, a nurse will help you. Um, so don't get self-conscious about it. They've seen it all. They're just there to help you. So kind of having that in mind. I did fine with it this time. I think I can't remember how I did with Victoria, but um, I know in my younger years stuff like that was I felt very self-conscious and awkward about it. Okay, so toiletries, definitely take your toothbrush, toothpaste, etc. Hair care, definitely have your brush, hair ties for pulling your hair back. Um, you can take the stuff you would normally use for a shower. I ended up not taking a shower there. The shower in labor and delivery was nice, big, and roomy. The one in my hospital room was smaller, and I was just really sore and kind of uncomfortable, and I just wanted to wait till I was at home in my own shower. So I didn't shower at the hospital. I hope that doesn't gross anybody out, but that was just me. Um, Makeup, skincare, if you use those, take like the basics. Um, I use It Cosmetics foundation, and it's like an all-in-one. I thought I might use that just to kind of even out my skin tone while I was there to make me feel a little bit better. I ended up not worrying about it. I really did not care. Um, Make sure to take lotion and hand cream. Their soap is really drying on your skin, so for me, I can't stand dry, itchy hands, so I have to have lotion, so I took my own. Um, Home comforts. I have these little throw blankets that are like feather comforters. I took one of that. I like the extra weight, and for me, I love the way it regulates heat, so I use that. Daniel took one as well, or a twin size blanket so that you're not taking like a full size comforter with you. Take something smaller or any type of throw blanket if there's one that you like, just for that. Um, they did bring me extra blankets and stuff, so I didn't use the comforter until the second night after I had the baby. But you definitely also want to be careful with what blankets you have. You don't want anything that's going to cover the baby, or just they'll be there to watch that you're extra careful with the baby. Just that was one of the things I was kind of had in the back of my mind, was being careful that nothing that would be dangerous for the baby. Pillows. I did take two pillows. Daniel used one. I can't remember if I used one, but Definitely have a different color pillowcase so that it doesn't get mixed up with theirs. Um, and then take, we packed the boppy and had it in the car. I kind of wish I had had it inside. I wasn't thinking about it. They were giving me pillows to kind of prop up the baby while I was breastfeeding. The thing I didn't realize is I was hunching over, so after a while, I think by the time I came home, my back was like really sore from hunching over and feeding the baby. So definitely take in a breastfeeding pillow to help. You kind of want to be sitting more upright and kind of like this picture. So, um, oh, the other thing I forgot to add on here was a towel. So if you are going to shower and their towels are like the little hotel towels, I normally use like a bigger kind of a beach towel at home, so I packed one just in case I need it, and I also packed a towel for my hair because I use a certain size towel for wrapping my hair when I dry my hair. So, let me see. So, that's it for home comforts. Snacks. Uh, if they're inducing, after you get all checked in and everything, the only thing they'll really let you have is they let me have like juice. They had apple juice, orange juice, and grape juice. I ended up drinking grape juice and just a little bit, enough to keep kind of my blood sugar up, and ice chips. After, definitely have some sort of, definitely have a drink on hand. Uh, they provide you a big cup with water. I drank lots of water. After a while, I was kind of a little bit done with it and wanted a Coke. And Dan had a challenge finding the vending machines. They weren't as close by as we thought they would be. Also, make sure you have money for the vending machines and find out where they are kind of ahead of time. Um, also, and then have any snacks that are something that you would find satisfying. Like Joey was born at 5:30. Um, I can't remember if we were able to get a meal the day of or if it was too late by the time we went to our room. So just something to be aware of is to have snacks on hand just in case you can't get a hospital meal the day you deliver. Also, the meals took probably about 45 minutes from the time we called and ordered. And then if you have a guest or for dad, the meals will cost. They were able to take payments, take a credit card when they dropped the meal off, so that worked out. Um, I think at Baylor they were like $10. Um, and my meals were covered as part of, I guess, the overall stay for labor and delivery. Um, Want to give you a quick overview of each day that I was there. So the first day, so like day -1 would have been the day they kind of the night before. Let me back up. So Joey was induced on his birth date. So we had to show up the night before, I think like around 6 p.m. We had, eaten dinner ahead of time, went, got checked in. I think they set me up with an IV. Shoot, I totally can't remember. But there's certain steps that they start before. So on the day that, so there's a YouTuber called Tara Henderson. If you go and look at her labor and delivery video for 2019 for her son Grayson, that's pretty much how my delivery went. If you wanted a better details on to see how the process goes. But right after delivery, they do 1 hour skin to skin with the baby, and then after that, I want to say it was probably a little more than 2 hours later that they moved us from labor and delivery to our hospital room. And there's a whole section specifically for newborn moms. I forget what the what those rooms are called, but they had a nurse checking on me every few hours, doing blood pressure, heart rate, basically your normal vitals, checking the baby's vitals. You'll have your baby's first diaper change. The nurses did that, which was really nice because it's that black tarry diaper. Um, and it's kind of, we were kind of freaked out. Joey was so tiny and so cute and adorable, and it's just, they seem so fragile. And some of that stuff, you're kind of scared at the beginning. So it's normal to be scared, you know, accept, they're going to offer help, accept the help. That first night, there was very little sleep. Joey would nurse every probably 2 to 2.5 hours. I might get in like maybe an hour and nap. Um, Definitely limit visitors the first day. You're going to be sore. You've just gone through this traumatic event. Um, we had some challenges with certain family members that didn't understand why we didn't want people there the first day. But for me, it was just I was going to be tired. I was going to be moody. The only person I wanted was my husband, and so the first day, kind of, and I became germophobic. I was so afraid of things that would be introduced to baby. So just something to keep in mind. Day two, be prepared to fill out paperwork. Definitely meet with the lactation consultant, even if you think you're not going to breastfeed. Just meet, talk with them, ask them any questions you have. The one we met with was great. Joey latched on right away, but by the next day I was hurting, and he wasn't getting quite the perfect latch, and I needed help trying to figure out how to get his mouth to open a little bit more. Later on, I ended up using these nipple shields by Mandela, which would force him to open his mouth a little bit bigger, and it worked. Those worked out great. On day two, they'll do the baby's first bath. Again, you're not going to be sleeping very much. Try whoever is there with you, like if it's dad or whoever it is, try to get them to take some naps or get a little more sleep when you know you're up and around, just so that they get some rest to help you when you need to get some sleep. Cluster feeding, Joey would go like where he would like feed like every 30 minutes, and then my breasts were really sore, and was happy he was feeding, and it seemed like he was getting the colostrum, which was great, but I don't think I was necessarily as prepared for it as I should have been. If you have a boy, make sure you let them know that if you want him circumcised, to have that done. Your pediatrician should come visit, or a pediatrician at the hospital will come check out the baby to, make sure they're okay to go home. And be sure to order your hospital meals about an hour before you plan to eat. Day three, or the day you go home, you'll need to bring in your car seat. A nurse will inspect it. You'll put the baby in. They'll kind of show you how to tell how to tell that the straps are tight enough. If you can ahead of time, go get your car seat and get the base installed. Take it to a local police department. Have them check it. They'll make sure it's in there nice and sturdy. You'll get your release paperwork and definitely get all your questions answered. For me, it was like, what are signs to watch for? What's a sign that we should go to the emergency room, or we should call 911, and those things, because everything went fine. I just wanted to know the things to watch for, so if they happen, I would know what to do, and I wouldn't totally freak out at the time, that I would just follow the steps that I was told. And that's it. So I hope you like this video. If you have any questions, leave a comment down below. like it if you, press the like button if you found this helpful. And thank you for your time. And Kylie, if you're listening to this, good luck. You got this. Hugs. Bye.